first off, say your name and tell me who you are.
Peter Beilenson, Beilenson. I'm the director of the Sacramento County Department of Health Services.
Talk to me about the coronavirus and what are the biggest concerns?
The coronavirus is a novel or new virus. There actually are multiple types of coronavirus, including ones that cause the common cold. So this is not a new type of virus, it's a new species of virus, if you will. And it is obviously progressing through the world. Most of the cases, 99% of the cases, have been in China, but we're starting to get our own share as well.
Including a case here in Sacramento?
Yeah, we had a case in Sacramento County, which as far as we can tell, is the first case of community-based spread, which basically means, very simply, not related to travel.
Is there anything concerning about that type of spread rather than the travel-based spread?
Yeah, it will unquestionably become more widespread as time goes along. But the good news is, the bottom line is that 81% of all cases internationally now are mild symptoms or no symptoms whatsoever. So it's not turning out to be as serious a disease as people originally thought. It's most of the bad effects are on elderly people and those with underlying chronic heart and lung conditions, as is the case of the flu.
Is it fair to compare the two viruses?
Yeah, it is relatively fair to compare the flu to the coronavirus in several ways. Number one, they're both respiratory viruses. They're caused by coughing, aerosolized blood drops.
Is it fair to compare the two?
Yeah, it is fair to compare the two in several ways. Number one, both viruses, the flu virus and the coronavirus, are respiratory viruses that are spread by aerosolized droplets, by coughing water droplets on people. Number two, it will become more widespread, just as the flu is widespread, and the number of cases, at least worldwide, that are negative, that without symptoms. Sorry, I got to start again. Let me do this again.
You want me to ask you again?
Yeah, ask me again.
She's
scaring me.
Oh, sorry.
No, it's okay. Okay.
I am pretty scared.
That's all right.
Is it fair? She's with the mayor's office.
I know.
That's you.
I know.
It's like whatever. Usually they're scared of us.
Yeah, I'm not scared of you.
Make it easy. Is it fair to compare the flu virus with COVID-19?
Yes, it is fair to compare in several different ways. Number one, both in the ways that you prevent the spread of the disease, because both viruses are spread by respiratory, by coughing droplets on surrounding folks. So washing your hands, extremely important. Using alcohol wipes or the alcohol bottles not alcohol bottles, but
hand sanitizer.
Yeah, using hand sanitizer is important because alcohol is virucidal; it kills viruses, and the disease is different than the flu in that there's not currently antiviral medication for it or immunizations available for it, but that's being worked on right now.
Anything that the general public should do to protect themselves, and is there a big concern?
Yeah. So again, there is very likely that there will be additional spread, and it is very likely that the vast majority of cases will remain asymptomatic, without symptoms or in mild symptoms. And in fact, one of the important messages to get out to folks is, if they're sick, or if their child is sick, assuming that they're not really sick, stay home from school and work to keep it from spreading. And vice versa, if you're not sick, try to avoid areas where there are a lot of sick people, like emergency rooms or doctor's offices, unless you really have to go. So by that, in those ways that we're sort of self-isolating, will allow us to keep the spread down to some extent, but it's certainly going to spread.
Do you want to take a minute?
No, I'm fine.
Sure?
Yeah, this is my Parkinson's.
Oh,
Sorry, you got to take me from here out.
It's okay. I just want to make sure that you're comfortable.
No, I'm totally fine. Totally fine. Drives me nuts. Anyway. Sorry.
Yeah. Well, yes. I appreciate you speaking with us today.
No, I'm capable.
So we saw this this spread as well, and there was another Solano County, and there's been, I believe, 15
cases, yeah.
reported in California.
Yeah, 14 of them related to travel.
When you see the reports and you see the reaction worldwide to the spread of the virus, can you explain, or do you have any thoughts on what has driven this to be such a I guess a big deal in terms of the media attention, in terms of the way that health authorities like the WHO and the CDC and Chinese and Japanese authorities looking at it?
Right. This is actually something that happens fairly often in the 25 to 30 years that I've been involved in public health. Every few years there's a new viral infection that comes out, whether it's H1N1 or West Nile, et cetera, et cetera. They all start off kind of with a big bang that this is a very new and scary disease. It turns out that the vast majority of cases are without symptoms or mild symptoms, and the death rate comes down dramatically over time, and they end up being part of the sort of general milieu of the infectious disease system of the world. So I expect this to be something very similar to that, where eventually it gets to the point where most of those with mild and no symptoms are not even being tested, and the tests are reserved for the sickest people, and that allows our hospitals to treat those who are particularly sick. And again, those who are most at risk for this condition as well as for the flu are those with chronic underlying diseases like heart disease and lung disease and elderly people.
The Chinese authorities have taken perhaps the strictest precautions we've ever seen in world history to prevent the spread of a disease. Quarantining essentially a city of 13 million people, roadblocks with temperature checks, shutting down airports and businesses. Is it possible we would ever see with this virus something here? And are those types of serious precautions necessary if we see spread of this virus in the States?
Because it's very likely that as the disease spreads, it'll be in mild and moderate, mild and asymptomatic cases, which will actually not end up getting tested. Eventually, I think it will be a case of just this becomes like the flu, and we have a normal kind of year with sort of serious, with a decent spread of this condition. But I don't think it will ever come to the kind of mass quarantines that they're doing in China, in part because so many people don't have symptoms or have only mild symptoms that they don't attribute to the disease. And so they aren't going to even be tested for it, but yet they'd be shedding virus, which which means they could be contagious. But again, it's important to point out to people, as I've been saying over and over again, that this is 81% of all cases internationally so far are mild symptoms or no symptoms. And so as this disease spreads, it should be mostly like the flu.
Yeah. Trying to think anything else? Anything that we didn't ask or anything that you'd like to...
Yeah, one thing. So it's not too late to to put this in perspective. The flu has affected 25 million Americans so far this year, already in the United States alone. 180,000 hospitalizations and 12 to 15,000 deaths. Excuse me. Sorry. It's important to put into context how this relates to the flu. We have 60 cases so far in the United States of the novel virus, the coronavirus. We have 25 million cases in the United States of the flu, 180,000 hospitalizations, and 12 to 15,000 deaths. So it's still very important. It's a much, much bigger problem nationally, both this year and in coming years. It's important to get vaccinated because it keeps people from getting the disease, or at least keeps them from getting a severe form of the disease. And it's not too late to get your flu vaccine.
My last question would be, why does the county health officials, and we saw state officials talking about today, why is it important for you to address this now? And
I think it's important actually to reassure folks that this is not some gigantic disaster or anything like that. This is, again, something that happens very frequently in the world of public health. Every few years, a new condition, a new virus pops up that gets a lot of attention initially and eventually ends up in the sort of general infectious disease system of the world.
Great. Thank you so much. Very
Sure.
nice to meet you.
Sure.
Yeah.
Thanks.
Thank you.